Now, talking about doctors and doctors being doctors, you want to change, by bringing in this app, you want to change how they do their everyday work. If they've been always using a specific app, how do you think that you need to change the mentality of the doctors, thinking like, no, I've been using this app all this long, why should I be using? They will always question the why. Why should they be using this app? So how do you do that? How do you handle that change of mentality?
First of all, I think the most important message, if I'm faced with a group of junior doctors or the hospital groups, I would say to them, we're actually not changing the way they are doing things in terms of messaging. We are merely replacing it with something that is dedicated for clinical messaging. So we're just replacing it. But as we know, with anything new that's being introduced anywhere, and especially in healthcare, because people are busy, there will be suspicions, there will be resistance, but there are ways to overcome this. So you were alluding to how you change that mentality. Okay? So this will require change management. Okay? And change management in healthcare is very challenging. It requires a top-down approach and bottom-up approach, and also changes in policies.
Okay.
So top-down will be from clinical leaders and healthcare management, and from the Ministry of Health. Bottom-up will be the workforce, and I always think about the millennial doctors. They are the future of healthcare, and they embrace technology easily.
Okay, interesting. So that particular patient data, organizing patient data, because I'm not a doctor, I wouldn't know what a doctor goes through throughout their life. So for the people watching at home, why is it important for them to organize patient data? How many types of cases does a doctor go through? We don't really know that. So maybe we can talk about how that actually helps, say, a junior doctor starting work. They don't know what's happening around them and things like that. I believe in the earlier interview, Dr. Anita was saying that she used to carry a notebook, and she used to have like every page for every patient. So how important is that organizing patient data? And does that disorganization, if there is a disorganization or a miscommunication, how detrimental is that for the patient health?
Right. Let me answer that last question first. There is data on this, and a lot of this kind of data comes from America, because they are more established in terms of looking at the impact of hospital activity on patient care. So a report by CRICO, for example, Control Risk Insurance Company, they looked at the impact of poor communications on patients. So this is poor communication within hospitals. They have shown that I think over a period of a year, 2,000 lives were affected.
2,000 lives
were affected from poor communication. And 37% of medical litigation cases resulted in severe injury to the patients from poor communication.
Wow, that's a very high number.
I don't think it's difficult to get this kind of data in Malaysia, because we don't really measure these kind of things. America is really good at this. UK has some data, but the best data comes from the US. So that's in terms of the impact on patients. Okay? So coming back to the other parts of your questions, on day-to-day basis, okay, if doctors don't have an efficient way to communicate, okay, clinical communication is at the heart of medical care in hospitals, right? Then they can't make quicker decisions. And the best example will be when you're discharging a patient. Okay? One patient may have more than one team looking after them. Okay? So a patient in cardiology may have a renal team looking after them, or a neurology team looking after them as well. Okay? Sometimes you just need an okay from one of the teams to discharge the patients, okay? Because doctors are busy. So you need a true collaborative clinical platform where these conversations can take place. Okay? Because it's a bespoke clinical messaging app in Circles, the different teams can have the common information about the patients already there to inform them how to come to a decisions. Okay? So in hospitals, poor communications, the best example on how it impacts patients is the delay in discharge. So delay in discharge is a real problem for hospitals because then you're blocking up beds, right? And also problems for patients because the longer patients stay in hospitals, they can get this thing we call hospital-acquired infection. Yeah? So it's not good for the public hospitals, actually not good for the private hospitals as well. So the longer patients stay in hospitals, private hospitals don't actually make money after a certain length of time because they make money in the first few days of admission.
Can we see any future implementations of Circles.MD? Do you see any other applications that it may move into towards the future and things like that?
Yes. So, Dishen, this is just the beginning. Okay. So, in Matt Planner's vision for digital health, we believe that we should start with the healthcare professionals, okay, because they are the bread and butter of the workforce. Okay. If they are all entrenched in and embrace the digital health, I think then will be easier to open up portals, for example, to patients. Okay. So we do have in our roadmap for the next app to be our patient app.
Oh, a patient app. Wow.
Yes.
Okay.
Yeah.
Okay.
Yes.
All right. So all the best to you. All the best to Matt Planner. Thank you so much, Dr. Ezam, for your time.
Yes.
And thank you for watching. This has been Health Matters with me, Dishen Kumar. We talked today about communication. It's very important in our lives, but from the perspective of doctors, how doctors' communication can actually, miscommunication can actually affect you as a patient, and what do we need to do to improve that. So I hope you enjoyed this show. To all doctors watching, maybe it's time for you to actually change, move away from these social media messaging platforms and things like that, and look into apps like Circles.MD. So I hope you have enjoyed this show. This is Health Matters with me, Dishen Kumar. I'll see you in the next episode. Goodbye.